Hi, beautiful people. Welcome back to my YouTube channel. If this is for the first time, you're welcome. My name is Ishalona, and on this channel, we create content on faith, on health, on nursing, as well as makeup. So, if these are the kind of content you're looking at for, please do not hesitate to like, to share, as well as subscribe to the video. So, in today's video, we're going to be talking about something very important. For those who don't know, I am a registered nurse and a registered midwife, and by virtue of my profession, I have been privileged to work in different levels of healthcare from the grassroots level to the tertiary level. And in these different levels of healthcare, I have come across several dilemmas that happens in the society, witnessing them in the healthcare setting. And I feel we should discuss it while trying to throw more light on certain situations or topics. So, having said that, we're going to be talking about abortion. Now, I don't think the word abortion is a new term where you live, irrespective of whether it is legal or illegal in whatever country you reside in. What is abortion? Abortion is simply defined as termination of a pregnancy before 24 weeks of viability, which could be spontaneous or induced. Now, what we mean by 24 weeks of viability is from 24 weeks, the baby, if born at that time, can be managed in the hospital setting, or can be managed in the hospital setting and eventually go on to live a normal life. Now, in Nigeria, the available statistics indicate that about 1 million abortion is being carried out yearly, and of this, 11% of it is being attributed to be illegal, and of this, about 50% of it is being carried out amongst adolescents. Now, having known this, what are the reasons for abortion? Irrespective of whether abortion is termed right or wrong, there are several reasons why people terminate pregnancy. Now, one of such reasons is unplanned pregnancy. Now, for pregnancy, delivery, and after childbirth to be carried out, there are certain things and factors that have to be put into consideration. The financial aspect, the health aspect, the physical aspect, and all of that. Now, in a situation whereby financially, mentally, emotionally, or whatnot, the couple or the people involved are not ready, they might decide to opt for abortion. Okay, so because that pregnancy is an unplanned pregnancy. Another reason could be as a result of rape. Now, for people who are victims of rape, be it being gang rape or not, and they eventually get pregnant, they might not want to keep that pregnancy. So they might decide to get rid of the pregnancy. Also, there's also the reason of existing health challenge. Now, for pregnancy, it's a very life transforming experience, and for you to be able to carry your pregnancy, there's a certain level of sound health that you ought to have as a woman. Now, in situations whereby a person already have existing health challenge, for example, cardiovascular condition, it makes it quite difficult for the person to be able to carry the pregnancy to term. It's not that it's not possible, but it could eventually have a toll on the woman's health. Now, in situations like that, okay, termination of the pregnancy might be another substitute. Finally, and not limited to this, we have congenital malformation. Now, pre-knowledge of the presence of any abnormality or malformation in the embryo or in the fetus, the woman can opt to terminate that pregnancy by suggestion. Now, what I mean by that is the woman who is pregnant goes for a scan. Now, in carrying out the scan, if it is noted that there are some abnormalities present in this baby and she's told about it, she has the right to decide whether or not she wants to terminate the pregnancy or keep the pregnancy. Irrespective of the several reasons individuals might have to terminate pregnancies, there are statutory laws that have been established on abortion. Now, in countries where abortion are termed a criminal offense, there are certain guidelines that are put in place for this act to be carried out. Now, abortion can be carried out if it poses a health risk to the woman involved. That is a mental and physical health risk to the woman involved. So now, take for example, the woman involved, the woman who is pregnant or carrying a child has the possibility of dying. Do you understand? As a result of this pregnancy, abortion can be carried out in a situation like this because it's going to affect her health. That is, it's going to indefinitely take her life. All right. So abortion can be carried out in this situation. Another reason why abortion can be carried out under the law is if it poses health risk to the already existing children. Now, for a woman who is who just put to birth, for example, she had a baby and a baby is 2 months old, if such a woman should take in again when her baby is 2 months old, definitely it's going to deprive her of being able to take care, breastfeed, and all the already existing 2 months old child. So in situations like this, definitely abortion can be carried out under law. Also, if there is substantial evidence that the baby, if born, will suffer from any physical or mental abnormalities, that is, if the baby is going to be seriously handicapped, one hand, one leg, one eye, for example, situations like this, abortion can be carried out under law. Having said that, in Nigeria, the only reason why abortion is being legalized is if it poses a health risk to the mother. That is, if she's to carry this pregnancy to term, she will die. That's the only reason when termination of the pregnancy is allowed. Other than that, if the woman was being gang raped or whatsoever, don't terminate the pregnancy. It is not legal. Abortion carried out outside this clause is termed criminal, and it carries about 3 years to life imprisonment for the persons involved. Whether you're the one terminating the pregnancy, whether you're the one that the termination of pregnancy was carried out on, whether you're the one that procured the drug, whether you're the one supervising, whether you're the one doing whatever role you play, you have your own punishment, like I said, which is about 3 years to life imprisonment, according to the law in Nigeria. Now, what are the kinds of abortion? We have two kinds of abortion. We have the medical abortion as well as the surgical abortion. Now, the medical abortion involves the taking of a certain drug, which I'm not going to mention. And the function of this drug is that it stops the hormone, which is progesterone, that is essential for the continuation of the pregnancy. Now, once that hormone is being stopped, another drug is also being administered, and that drug will help in contraction of the uterus or of the womb, thereby helping to get rid of pregnancy. Now, for medical abortion, you have a 0 to 10 weeks window for this abortion to be carried out. Now, secondly, I said we have the surgical abortion. Now, under surgical abortion, we have the vacuum aspiration. Now, this procedure is an invasive procedure, hence it's carried out using anesthesia. Now, what happens is that a speculum is being inserted into the vagina. The essence of this is for the cervix to be visualized so that the person carrying out the procedure can be able to see clearly what he's doing. Now, either before this or after this, anesthesia is being injected into the cervix so as to numb that area and prevent the person from feeling pain. Now, once the cervix is wide enough, once the cervix has been dilated, then a small tube is being attached to a suction device inserted through the vagina through the vagina, the cervix into the uterus, and the baby is being suctioned or sucked out with the suctioning device. Now, sometimes they could use a curate to scrape, the baby out. Now, that's why I said that this type of procedure is carried out very, very early during the pregnancy. Now, once it involves the use of the curate to scrape the lining of the uterus and help to get rid of the embryo or the baby, it is now called DMC, which is dilatation and curettage. Now, another type of surgical abortion we have is dilatation and evacuation. Now, this type of abortion can be carried out between 14 weeks to 24 weeks. Now, this type of procedure is also an invasive procedure, and certain medication might be given to help dilate the cervix, or a dilator can be used to help dilate the cervix. Now, dilatation, what I mean is widening the cervix. Now, it's easier for you to work with that when the cervix is widened. Okay. Now, once this is done, some drugs also can be given or administered to the person so as to help soften the cervix. Now, sometimes before this procedure is being carried out, shot is being administered to the patient's abdomen to help stop the baby's heartbeat before the procedure is carried out. Now, because this type of abortion, the baby has already grown to a certain level. There are other instruments that would also be used, for example, forceps to help, bring out larger parts of the baby from the woman's body. Now, having talked on the types of abortion, what are the complications or dangers of abortion? Because there are definitely complications of abortion. One of them is hemorrhage, which is bleeding. Now, there could be excessive bleeding. Now, there could also be what we call incomplete abortion. Now, in incomplete abortion, what we mean by that is that not all part of the baby, of the fetus or the embryo has been completely removed from the woman. Now, for example, if a finger of the fetus is left or of the baby is left in the woman's womb, it could eventually lead to bleeding, infection, bleeding, because it's now seen as a foreign body, and so definitely that woman will bleed to death. There's also risk of sepsis, which we call infection or septic shock as a result of widespread infection in the body. Carrying of the uterus, like I said, in D&C, there is the use of curate to help scrape the lining of the uterus to get rid of the embryo, because this is carried out at the early stage of the pregnancy. Now, in doing that, the uterus could be scarred, right? And this, in a long time, could predispose the woman to having secondary infertility. Now, having talked about this, I want to ask a question. There's a situation that happened one time. There was a young girl who was in GS1 or GS2. She actually attended a special needs school, meaning she was both deaf and dumb. And this girl was brought to the hospital, ran pregnancy tests on her, and realized that she was pregnant. According to her, she had not seen her period for the last 2 months, and so that was the reason why she was brought for testing. And when the test was carried out, she was pregnant. Now, for a person like that, what is your advice? What would be your advice for her? Even for women that were gang raped, if someone comes to you and she has been raped by her father and she was currently pregnant, or she was raped by a group of 6 men and she was currently pregnant, bearing in mind that in Nigeria it is illegal to carry out abortion, okay, on someone if it does not affect the health, physical health of the person. What would be your advice to such an individual? All right, with that, I've come to the end of this video. I hope you learned from it. If you have any questions or recommendations or comments, please leave them in the comment section down below. And until I see you next time, God bless you and bye, love.